This discussion is going to look at cancer and how we can utilize physical activity to help improve the quality of life for individuals with cancer. So first, just looking at the general pathology related to cancer and something to understand, obviously there are various forms of cancer that impact many of the different body systems. So the chapter and in this class, we're kind of just looking at cancer kind of in a broad sense, focusing a lot on kind of looking at and getting some background in the medical management. First, when we look at cancer, so a malignant cancer cell, so we're basically looking at tumor growth, and when you essentially look at a malignant neoplasm, there's certain things that kind of differentiate a cancerous tumor from what we'd call a benign tumor. So a malignant neoplasm basically have sustained proliferative signaling. They evade growth suppressors. So in other words, they grow very rapidly. They resist cell death. They enable replicative immortality. So again, these are basically cells that continue to grow kind of, without any sort of regulation to them. They induce angiogenesis, which is basically the formation of its own blood vessels to kind of help sustain themselves. They're very invasive, and one of the common things you'll also hear with cancer is the term metastasis, where then the cancer could kind of move throughout the body. They reprogram energy metabolism, and they evade immune system destruction. So these cells basically grow. The body has no way to regulate them. They become invasive, and then they start to create other problems. Whereas as a benign tumor, benign tumors kind of have unregulated growth, so they're tissue that basically grows, and through the growth of cells. But basically, they're not invasive. They can potentially cause some problems, but for the most part, if that is the case, whatever, a benign tumor presses on a nerve or something like that, in many of those instances, the benign tumor just gets removed, and then there's no issues associated with it. Whereas, the malignant cancer cells, just based off of all of the qualities I just described, they continue to grow, they're invasive, they metastasize, those things. So that's really the difference when you're looking at the two different types of tumors, and really kind of what sort of defines cancer. So continuing on with some background with cancer. So again, the American Cancer Society kind of tracks a lot of things associated with cancer. And today, 1 in 4 deaths in the United States is due to cancer. Most cancers are diagnosed in people greater than or equal to over 50 years of age. It's around 86%. So again, typically once people get into their 50s, that's where it's more commonly diagnosed. And cancer is also the second leading cause of death among children between the ages of 1 and 14 years. And we'll talk a little bit about the different types of cancer that primarily affects children. So physical activity, again, we've mentioned, throughout this, the various benefits throughout the different body systems. So physical activity does play a role in prevention, and it was a way to improve life and survival of patients with cancer. So physical activity has been proven to both help and prevent cancer, but in the circumstance where it does develop in somebody, does help improve the life and help with their survival, again, through improved strength and just improved cardiovascular health. It does benefit it. Again, as I said, most cancers are diagnosed in people over 50 years of age. So again, that's when a lot of your cancer screenings become all the more important for these individuals. As far as the prevalence, if you look at for men and women, for the different types of cancer, for women, it's breast cancer, 1, lung 2, colorectal 3. For men, it's prostate 1, lung 2, colorectal 3. As far as deaths, so we're looking at all the 2016 statistics. Some of this may have changed. This is just kind of what's covered in your textbook. So to keep consistent, I'm just going with that for right now. As far as deaths, regarding both genders, so if you're looking at men and women kind of together collectively, lung, colorectal cancer, and pancreatic cancer, 1, 2, and 3 as far as most common related to deaths. If you break it up by gender, for both genders, lung is still number 1, then breast cancer for women, prostate cancer for men, and then colorectal would be the third for each one. In children, so I had mentioned, in ages 1 to 14 years, it's still the second leading cause of death. Leukemia is the most common, and then you also have various cancers of the brain and central nervous system for young kids. So the pathophysiology as far as cancer is concerned. So cancer is viewed mostly as a genetic disease that occurs due to DNA mutations. And part of that is going to be basically triggered through exposure to carcinogens. So carcinogens are cancer-causing agents. So many times, if a person is exposed, environmentally to, say like an environmental carcinogen, that could potentially kind of spur this process on of developing cancer, or it just can occur spontaneously. Other mutations occur when certain, genes whose gene products regulate DNA replication or repair are mutated. So the book gives the example of the P53 gene. So, so essentially you're basically looking at something that happens within the DNA, whether it's just purely genetic, whether it's genetic and triggered by a carcinogen that basically creates the malignant neoplasm, and then that malignant neoplasm, wherever it's formed, that's essentially the type of cancer that the individual has. So looking at management and treatment, and this is going to be a lot of what we're going to talk about in this chapter. So a lot of again, just kind of general management and treatment. I'll probably make mention of some specific types of cancer, but again, as I told you all in class, there's obviously so many different types and so many different ways cancer can present itself that we're just going to look at kind of the how it's assessed. Like I'm going to talk about the Tnm system here in a second. This is going to be a really important part of what you're going to have to know as it relates to cancer. And then we're going to talk about all the various treatments, because obviously that becomes very impactful from an exercise professional standpoint as to how you're kind of helping manage the individual's physical activity. So the Tnm system, so that it stands for tumor, lymph node involvement, and metastasis. And metastasis is obviously, as the cancer travels elsewhere, gives you the pieces of information. So, and this is essentially how a person kind of gets staged relative to their cancer, as far as basically how far the cancer has kind of progressed. So T describes the size of the tumor and is either ranked from 0 to 4, depending upon the size and how basically how invasive the tumor is. The N describes the lymph nodes. Okay, so your lymphatic system is a really important part of the immune system, but cancer can metastasize, get into you have cancer of the lymphatic system, but then you also have cancers that will kind of metastasize and travel through there. And what they'll basically do is look at, have lymph nodes been affected by the cancer? And again, that could go from 0 to 3. So basically 0 would obviously be no invasion of lymph nodes. And then M describes the presence or absence of cancer metastasis to other organs. So again, and you have basically no metastasis or metastasis is present. So again, once the Tnm descriptors of a tumor have been defined, they're kind of all combined together into a set of stages. And basically, when you're talking cancer stages, you have stage 0 to stage 4, okay? So basically, the lower stage numbers basically describe small primary tumors, no metastasis, whereas higher numbers, basically, like say you're at a stage 4, are used to describe cancer that is basically, it's invasive, it's metastasized to other organs, there's lymph node involvement, is essentially what you're looking at with that. So again, you have your Tnm system, and you can kind of see the numbers within this, and then basically, you know, you have your stages, again, 0 to 4. And again, I'm not going to necessarily make you stage cancer, but you should be able to understand the system, because again, you may again get information back on a client where they say, okay, they're a cancer patient, here's their TNM, you know, here's their staging, and then you have kind of at least an idea as to the severity of the cancer and where the individual is at. So like I said, kind of the general assessment procedure that I just talked about and the treatment are going to be a lot of what we're kind of describing and going over here. So it's going to be important to kind of know the various management strategies and how they're treated, so that you kind of have an idea as to what the individual is kind of dealing with and the side effects. Because many times, you know, obviously a lot of these treatments have significant effects, like for instance, chemotherapy. You know, while chemotherapy has become much better over the years and the side effects have lessened, there's still pretty significant side effects from a lot of these. So that's going to be an important thing for you to know. So radiation therapy. So this is a local form of treatment that targets the area of the tumor, and basically what it looks to do is it basically looks to deliver high energy particle or waves through basically either X-rays or gamma rays to essentially destroy the cancer cells and prevent the growth and division of the cancer cell by basically breaking apart the DNA molecule inside. So, you know, depending upon the mode of applying this, for instance, a very high energy X-ray just basically gets delivered to a cancer cell, basically to essentially destroy it. And there's two ways this gets done. One is through an external radiation machine that gives high energy X-rays, or internally what they call brachytherapy, where basically a small container is placed inside the tumor or in the area of the tumor after a surgery, or it could also be given by drugs, and basically it's the same thing. It's just basically an internal delivery mechanism. Sometimes they'll actually just give radioactive drugs by mouth or injection as well. Again, it just kind of depends upon the type of cancer and what the oncologist believes would be the most effective way to essentially get the radiation to the tumor cell. Chemotherapy involves delivering chemotherapy drugs into the bloodstream to treat cancer cells that many times have metastasized to other parts of the body. How long a person will get this depends upon various different factors. You know, the type of tumor, the phase of the tumor, the patient's tolerance to chemotherapy. Again, chemotherapy does tend to produce various side effects to it, particularly when, like right after it's been administered. But that kind of dictates the protocol there. Chemotherapy does significantly reduce the risk of cancer recurrence after surgery. So many times an individual, even if a cancer can be completely removed, many times it will still be prescribed to do chemotherapy just to make sure that if by chance there was even a little bit of cancer left behind, there's some cancerous cells that the chemotherapy could basically wipe it out. So those are some things to kind of make note of when you're looking at this. And again, there's significant side effects to all of these different, you know, types of therapies, and we'll be mentioning those as we kind of get further along in the discussion. So you also have biological therapy. Biological therapy involves, you know, kind of various types of treatments. So this includes immunotherapy, biotherapy, biological response modifier therapy, and basically what all of these use is they use a large variety of molecules to fight the cancer or to lessen the side effects of some cancer treatments. So this form of treatment basically looks to interfere with cancer cell growth and it acts directly to help immune cells control the cancer. So, what we know is that the immune system by itself can't really control the cancer, but in the case of a biological therapy, you kind of almost give the immune system a boost. So beyond just, killing the cancer cells, it kind of gives the immune system a little bit of help, and then it just helps to repair normal cells that get damaged by other forms of cancer treatment. So this is something that can be utilized, say like for instance, in conjunction with a chemotherapy, because chemotherapy kills also healthy cells in addition to cancer cells. Like that's, for instance, the reason why many times with chemotherapy, individuals say lose their hair. It's because the cells that control hair growth basically die from the chemotherapy administration. Bone marrow transplant. So again, this, many times if you get a cancer that is affecting the bone marrow, so bone marrow would basically ablated or destroyed, and that would be ablated or destroyed through either chemotherapeutic agents, radiation, or both. The person's blood forming system is then replaced with either bone marrow cells from the same person when that individual's in remission, which would be considered an autologous bone marrow transplant, or a tissue antigen matched donor, what we'd call an allogenic transplant. So either a person could have bone marrow transplant from another area of their own body, and again, they would look to do that when they're in remission, or they would use a donor and basically do it that way. And then that would then replace the diseased bone marrow that was basically that would have been destroyed by one of the other forms of treatment. You also have hormone therapy. So hormone therapy uses drugs to modify body hormones. So to either stop the synthesis or change the effects on specific cells or block tumor growth. Again, only some tumors are hormone receptor responsive and respond to this type of therapy. So usually hormonal therapy is really only going to be utilized for certain types, for very specific types of cancer, particularly breast cancer in women and prostate cancer in men is really where you're going to see most of your hormone therapy taking place. And again, it's going to use specific drugs to help modify the hormones to kind of assist with blocking tumor growth. Now, as we said, there's various side effects. And again, side effects are going to be of treatment are going to depend upon the type of radiation or drugs, the amount given, and the length of treatment. So again, there's a huge variety of this. Obviously, oncology is the medical specialty that deals with cancer because of the many different types that you have. Your early side effects that you deal with, these are some of the more common things that you see: nausea and vomiting, temporary hair loss, increased chance of infection because, for instance, chemotherapy does suppress the immune system, skin changes, loss of appetite, pain, hemorrhagic and thromboembolic complications, so the person can be at risk for blood clots, allergic reactions. Those are many of the early side effects. Then you get your late side effects. Late side effects are those that take months or years to develop. Some of them are permanent. And many of your severe side effects include toxicities in many of the body systems and organs. So the hematologic and immune systems, they could have cardiovascular toxicity. You could have pulmonary toxicity, musculoskeletal alterations, gastrointestinal toxicity, hepatic toxicity, nephrotoxicity, neurotoxicity. So basically, I just ran through all the different systems of the body that can possibly be negatively affected, even years down, months to years down the road from the treatments that the person gets. So many times, the treatment protocol, it's going to be kind of like the risk benefit. If a person needs high dose chemotherapy, how long, for instance, will they do that for, to the point where actually the treatment will possibly cause health problems beyond the cancer. And again, many times that's something that gets discussed between the patient and the medical team that they're working with. So cancer-related fatigue. So this is probably the most distressing part of both having cancer and getting treated for it that many people experience. Whether it's the cancer causing it and or the treatment that they're getting, there's a significant level of fatigue. And this becomes one of the more difficult things to kind of encounter for an individual with this. So fatigue is the most common side effect. It affects up to 70% of those who have cancer during chemo and radiotherapy and after surgery. So this, again, is probably one of the more distressing things to kind of deal with. Individuals are usually advised to rest and decrease their level of activity. However, as we all know, inactivity actually produces muscular catabolism. And many individuals with cancer suffer from something that's called cachexia, which is a muscle wasting disease because of the fact that they're so inactive that their muscle basically atrophies and they experience severe muscle wasting. So, and actually just even extended periods of rest lead to chronic fatigue. So here's that kind of balancing act that we kind of have to assist with and encourage individuals with cancer to do, physical activity that they could tolerate, regardless how little it might be, to kind of help, prevent this. Because again, certainly then we don't want to lead them into where, other comorbidities also then will develop, which will negatively impact both their health and quality of life as well. So other things that also contribute to cancer-related fatigue. So anemia, and anemia could come about by virtue of the treatments that the individual is getting. Pain itself can certainly disturb sleep, and also limit a person's activity. Emotional distress, again, general sleep disturbances, nutritional problems that the individuals have, which they may have even had, prior to and leading into the cancer treatment. Again, just low general levels of physical activity. If you're, these individuals reducing their physical activity could also negatively impact and possibly lead to fatigue as well. And medicines are all possible causes of this. And again, fatigue in a lot of ways is mainly caused by the illness itself. So cancer itself causes fatigue. And then, between that, the treatment, the inactivity, all kind of contributes, further contributes to it. So it just kind of keeps piling on, unfortunately, and leads to this state. Sedentary habits are usually recommended by the biomedical staff and the family to protect the person. However, that leads to this, again, that self-perpetuating fatigue cycle that we kind of discussed earlier. And exercise can help improve this. So one of the things to kind of note is that to get what, your book refers to the big team. So that's your physicians, your nurses, your social workers, physical therapists, athletic trainers, nutritionists, exercise professionals, whoever's all involved to kind of work on this, because exercise can certainly help. There's been benefits of exercise. So studies have found, even like for instance, with breast cancer and prostate cancer, improved survival rates, and just overall improved markers of physical health. So improved oxygen transport, cardiac improvements, muscle function, increased mitochondrial density, improved muscle fiber vascularization, cardiac ejection fraction. So just your markers of, how well your heart works, and just muscular efficiency. And again, these are just, again, the same benefits that anyone can experience, but obviously for somebody who, has been diagnosed with cancer, undergoing these treatments, we want to basically try to break this, again, this self-perpetuating, fatigue cycle to kind of help the person, again, quality of life, survival, can certainly all be enhanced by all of this. Lymphedema is another thing that very commonly happens in individuals with cancer. So lymphedema can occur after lymphedectomy, where they basically surgically remove the lymph nodes, or after radiotherapy that affects the lymph nodes. And basically what happens is there's diminished lymph flow. And again, the lymphatic system is responsible for kind of regulating it basically helps to prevent swelling. And in the case of where, there's obviously, alterations due to either treatment or the type of cancer, you get this accumulation of interstitial fluid, and then you get inflammation and swelling due to the lymph fluid buildup. It might help for you to do, even if you just kind of think a little bit back to, anatomy and physiology, how the lymphatic system works. But again, the lymphatic system is basically responsible for allowing us to not have swelling in our body. And in the case of where obviously it's altered due to the cancer, the treatment, it would happen. So for instance, upper limb lymphedema is very common following a lymphodectomy due to breast cancer. Many times lower extremity lymphedema could be caused in cases where you have particularly something to like the lower quarter of the body. Now, it's important to note that many times healthcare professionals, and this is sometimes where like there's some breakdown in communication, and where, again, individuals educating themselves can kind of help the process. But healthcare professionals many times warn individuals, for instance, to avoid like intense upper body exercise to avoid causing lymphedema. However, up to date, there's no data to support a link between upper body, for instance, many times with breast cancer patients, they'll say, well, don't do any type of, vigorous upper body activity. There's no data to support that, like, for instance, upper body exercise will cause breast cancer related lymphedema. So, it's you may look at a risk benefit there, but there's really no direct link to that. So again, you do obviously want to mind things, but again, you want to make sure that an individual is getting the proper activity for what they need. So again, it would be important to communicate with the healthcare professionals, but at the same time, make sure we're still doing things to make sure that we're kind of maintaining the person's physical abilities. So looking at some different types of chemotherapy medications, there's alkylating agents. These particularly work in all phases of cell division by preventing the normal processes of DNA replication, gene transcription, and translation. So many times these are used to treat various cancers, but they can produce long-term side effects to bone marrow. And in many rare cases, acute leukemia can actually develop with high doses. So an individual can actually develop an acute leukemia if high doses of this are given. Again, interestingly enough, this type of chemotherapy is commonly used to treat leukemia. It's also used to treat lymphoma, Hodgkin's disease, which is a cancer of the lymphatic system as well, multiple myeloma, sarcoma, lung, breast, and ovarian cancer. And there's various different types. Your book does list some of these, and you could kind of make note of them. So like nitrogen mustards, nitrosurias, alkali sulfonates, triazines, ethylaminides, and platinum drugs are all different types of alkylating agents that are used in chemotherapy. So continuing on with the different types of chemotherapy medications, anti-metabolites, these are the most often used type of cancer drug. They work during what's called the S phase. And if you're a little, foggy on that type of biology, the S phase is essentially when the cell's chromosomes are being copied, and they basically look to distort the normal synthesis of DNA and RNA, because again, the idea is to, to basically help in preventing the replication of that, to help destroy these cancer cells. These are commonly used in leukemia, breast, ovarian, and intestinal cancer. So again, the big thing I kind of want you to know is just, be able to primarily differentiate between how many of these chemotherapy medications work. So again, this one's primarily during that S phase, and then this prevents that copying part of the cell to prevent it to both destroy it and prevent it from replicating. So then you have what are called anti-tumor antibiotics. These basically integrate into DNA's base pairs and prevent normal function and block tumor cell growth and multiplication. So these are not the same as the antibiotics that you think of to treat infections. So, ear infections, sinus infections, these are a different type of antibiotic. And they have specific types. The anthracyclines interfere with the enzymes involved in DNA replication, and they work in all phases of the cell division. One kind of negative part of this is that the high doses of this can possibly produce damage to the heart. And then the non-anthracyclines work as topomerase 2 inhibitors. So in looking at that, these are just basically the non-anthracyclines, and we're going to actually talk about topomerase inhibitors up next, but these basically are just another way to help prevent that further tumor cell growth and multiplication. So topomerase inhibitors, these interfere with the topomerase enzyme, which are basically enzymes that separate the strands of DNA to be copied during the cellular S phase that we had talked about earlier. So, and then you have two different types. You have topomerase 1 or 2 enzyme inhibitors. I'm not so much concerned that the examples of each type. But basically, the big one to point out is that your topomerase 2 inhibitors are basically helping to augment the risk of a second type of cancer forming. So, for instance, many times a second type of cancer could possibly form through the other treatments. For instance, an acute myelogenous leukemia can form, which then would have to be treated as well. The topomerase type 2 enzyme inhibitors can kind of help prevent that from occurring. These are also in general used to treat many of the types of cancers we already talked about. So certain leukemias, lung, ovarian, gastrointestinal cancers, and again, whether you'd use one or, topomerase 1 or 2 will be just based upon, again, the type of cancer and what they feel will be the most effective for treating it. Anti-mitotic or mitotic inhibitors, again, these interfere with the structure or function of the cellular microtubular apparatus, and these will actually stop mitosis in the cellular M phase. Now, the important thing here is these can also damage cells in all phases of cell replication by basically slowing the enzymes necessary to synthesize the proteins for cell production, or reproduction rather. One major kind of side effect to these is that they can cause nerve damage. So nerve damage is a common thing that can happen for this. Again, these are used to treat, various cancers, breast, lung, myelomas, lymphomas, leukemia. But again, the most common thing you kind of look at with this is the big side effect from this is the nerve damage that can occur. So corticosteroids, so we've talked about corticosteroids in previous chapters. So these are anti-inflammatory hormones, and these are actually used prior to chemotherapy to prevent allergic reactions to the chemotherapy and to help limit or prevent some of the side effects. Now, it's important to note that, again, corticosteroids, particularly if they're given in larger doses, they can have long-term side effects. It's important to note that corticosteroids are catabolic agents. So muscle atrophy, osteoporosis, immunosuppression are common side effects whenever anybody's treated with corticosteroids for various issues. Again, corticosteroids get used, have many different pharmacologic applications. Here they're just getting used in conjunction and many times given prior to chemotherapy. These are your common types that I would want you to be able to recognize. Prednisone, methylprednisolone, and dexamethasone are your common corticosteroids utilized for this purpose. So hormone therapy is another form of chemotherapy. Now, hormone therapy, again, is going to be used on very specific types of cancer, because the idea here is you're trying to impact the hormones, and the cancer has to be something that kind of gets enhanced by the hormone production and has those appropriate receptors. So the two that we're going to kind of focus in on here is obviously the blocking of estrogen in the case of breast cancer, and testosterone in the case of prostate cancer. So looking at drugs that block estrogen. So you have, again, and review your table for names and types. It'll just kind of help, and in particular, it'll help with, again, remembering the side effects as well. You have the selective estrogen receptor modulators, which actually work as antagonists, or basically prevent the formation of estrogen in some tissues, and agonists, or allow or work like estrogen in other tissues. So your book gives the example of tamoxifen, which actually will block estrogen in breast tissue, but it'll work like estrogen in the uterus and bone tissue. So, obviously in the case of an individual with breast cancer, that's a benefit there to kind of block it within that tissue to prevent and help to destroy the tumor and help to prevent further tumor growth. There's other anti-estrogen drugs that are non-selective and have side effects, including nausea, gastrointestinal symptoms, loss of strength, fatigue, pain, and bone loss. When you look at the selective estrogen receptor modulators, I forgot to mention this. I wanted to bring up the side effects there. There you have fatigue, hot flashes, mood changes, depression, increased risk of blood clots, particularly in the lungs and lower extremity, heart attack, stroke, and then you could possibly have bone loss in premenopausal women with the selective estrogen receptor modulators. And that's, a lot of those side effects are common things you see, whether, anytime you're using any type of therapy that involves the hormones. Those are many of the types of things that you would see in individuals.